Biomedical Therapies. What are they? They are prescribed medications or medical procedures that act directly on the patient's nervous system. But these kinds can only be prescribed by a pharmacist, so don't go looking for them by yourself. Drug therapy. Since the 1950s, the study of drug effects on the mind and behavior has increased by the hundreds and thousands. Double-blind technique is used to test new drugs.
So, let me understand now. Both of you have been treated for depression, am I correct?
Yes. Yeah.
You've both been taking a drug which I have prescribed for you. And you both, how do you feel now?
I feel good. Great. Yeah, I feel awesome. No side effects at all. It's great.
Okay, that's very interesting. Very, very interesting. Because one of you have been administered a placebo.
Placebo? What?
A placebo. A placebo is a pill that has absolutely no medical benefit whatsoever. One has been treated for depression, the other has received the placebo.
So who got the placebo? Yeah.
You.
I got the placebo?
You got the placebo.
Then why do I feel fine? I mean, I've never been happier in my life. This is awesome. The drug obviously worked.
What we have done here is administered the double-blind effect, which causes the placebo effect. And what that means is that you believe, you want to get well so badly that you are believing in this pill, which absolutely has no medical benefit whatsoever. It's merely a sugar pill.
The anticipatory drug is similar to the neurotransmitter dopamine. Some produce drowsiness and nervous twitches and tremors. Anti-anxiety drugs are used with psychological therapy. Examples include the Xanax or Actavian for the depressed, and that will go directly to the central nervous system. Xanax can show psychological dependence due to patients taking the drug at the first sight of feeling anxious. Deep brain stimulation. This is used with patients with depression who have gone through the drugs and the ECT that did not help them. This was discovered by Helen Mayberg, a neuroscientist. Magnetic stimulation. This is using magnet coils to the patient's skull. Repetitive transcranial magnetic stimulation, the application of repeated pulses of magnetic energies to the brain. It is used to stimulate and suppress brain activity, which means no seizures for memory loss or other side effects. Psychosurgery is surgery that removes or destroys brain tissue in an effort to change behavior. One example of this is a lobotomy, which is a now very rare psychological procedure that cuts the nerves from the frontal lobe to the rest of the brain, resulting in a very, very boring person with no personality.
Rose, are you looking forward to the procedure?
Yes.
What did you do to prepare yourself? What are your plans for the future after the procedure?
Good. Very good. Very good.
Very good, Rose. Rose, how are you feeling?
Good.
What did you do today?
Ate lunch.
Do you feel better after the procedure?
Yes.
What are your plans for the future now that you've had the procedure?
Do stuff.
Now, this is only done in very extreme cases. However, during the 1950s, 35,000 people had lobotomies done in the U.S. Another way that people used to treat them back long, long ago is electroconvulsive therapy. And that used to be very, very, very dangerous. They'd strap them to a table. The patients would be terrified, and they'd shock them until they fell unconscious. However, now it is still in use. However, the patient is sedated and no longer has any recollection of the event.
This is the year 1935. This will be a demonstration on electroconvulsive therapy. Today our patient is Sylvia. Sylvia, are you ready for the procedure? Sylvia, on the count of 3. 1, 2, 3. This is the year 2012. This is a demonstration of electroconvulsive therapy. Our patient has been sedated and will awake with no memory of this event. On 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Another way is therapeutic lifestyle change, which can be aerobic exercise, getting a good night's sleep, light exposure, social connection, anti-rumination, and nutritional supplements. Out of 74 people, 77% showed relief from depressive symptoms after their simple lifestyle changes.